الو اوكي انا ماني شايف نفسي. لا. طيب مو مشكله. طيب اوكي شكرا. السلام عليكم. I would like to welcome you all to this lecture that I'm presenting, and this is for the Alzheimer's Day, which is on the 21st of September. Alzheimer's disease is a disease that affects millions of people, and what we are going to try to do in this lecture to make it simplified, as the topics says, Alzheimer disease simplified. I'm Dr. Saeed Abdul Qadir. I'm a consultant psychiatrist with Johns Hopkins Aramco, and we will go through this disease and make it as simple as possible for you to have an idea about it. So, giving an overview of this topic, we're going to go through some definitions of what dementia is in general and what Alzheimer's dementia is. We're going to talk a little bit about types of dementia. Then we will define what Alzheimer's dementia is. We'll talk about some statistics and variations between male, female, and the age of onset. Then we will go on to talk about some signs and symptoms of the disease, some tests and investigations that are commonly used to diagnose this illness. And briefly, we will touch base on some treatments. Then we'll talk about prognosis and expectations. And last but not least, a very important topic, which is the family and caregiver burnout for people caring for people with this illness. So if you look at this slide, it talks about the difference between normal aging and dementia. Because as expected, as we age, normally we will lose certain functions. So for example, forgetting names, misplacing keys, and becoming momentarily confused, these can be byproducts of either normal aging or can be early symptoms of dementia. Now, how do we differentiate between the two? If it's normal aging, the names will be recalled, the keys will be found, and the confusion will lift. It is normal for people of all ages, even teenagers can at times forget things, but they will come back and remember them, and life goes on. But for those who have some type of dementia, those names may never come back, and the memory loss and confusion becomes so debilitating with time that daily tasks like driving, shopping, paying bills can become increasingly difficult. So basically, when it comes to dementia, what happens is that it's not something that goes and comes. Unfortunately, when these things begin to happen and progress, they will continue to progress on a trajectory of illness getting worse and memory becoming worse. Now, let's talk about some definitions to make things more clear. Now, dementia itself is not a specific disease. It's an overall term which describes a wide range of symptoms. These symptoms can impact a person's ability to perform everyday activities independently. Common symptoms include a decline in memory, changes in thinking skills, reasoning skills, which can lead to poor judgment, decreased focus and attention, changes in language and communication skills. Now, it does not mean that everything will come straight away. Functions can be very in decline, and as we will see, in some types of dementia, they may happen suddenly. So, as Americans continue to live longer, and let's not just talk about the Americans, as people generally in this world are continuing to live longer because of better healthcare, better ways that they take care of themselves, people living healthier lifestyles, us having remedies for things that killed people in their 40s and 50s long time back when antibiotics were not discovered. Now, all these things are making people live longer. And as they continue to live longer, dementia is poised to become the biggest health challenge of the next few decades. The US Center for Disease Control and Prevention expects the number of people living with Alzheimer's disease, the leading cause of dementia, to be more than double from 5 million to 15 million by 2050. Still, what's sad is that about half of all cases of Alzheimer's, not to mention other types of debilitating brain disease, including non Alzheimer's dementia, go undiagnosed. They go undiagnosed, and one of the main reasons is that people may not understand the difference between normal aging and between what a dementia is and will not seek medical help. So this is one of the reasons that we are here today, is to provide education so that we know when to seek help. Now, is it better to know that we have dementia, or should we just ignore it? Because as it happens with many people, people tend to ignore symptoms of any kind. Dementia is just an example. Some people may be suffering from other symptoms, but they are anxious and concerned about going to the doctor because they may feel that they may have a serious illness. But the question is that, do we want to continue to ignore something that might be simple and curable? Or do we want to ignore something that may progress and become even more serious? Because no cure exists for most types of dementia, many patients and their families hesitate to seek professional help. But experts recommend speaking to a neurologist as soon as memory or behavioral problems occur. Helps to know about the illness and also helps catch the disease earlier and also provides more information, allowing the patient and the caregivers to deal with the disease in a better way. Getting an accurate diagnosis and prognosis, which is different for different types of dementia, helps patients and caregivers plan better and receive proper care and treatment. Now, as we said earlier, dementia comes in different types. So we're going to talk very briefly on different types of dementia and then focus on our main topic of today, which is Alzheimer's dementia. So one of the dementias that's common is vascular dementia. It includes a number of disorders in which cerebral vascular disease prevents proper blood flow to the brain, depriving the brain cells of oxygen and nutrients, which can lead to cognitive decline. Now, damage to the blood vessels can occur as a result of a major stroke, tiny strokes in which there's a blockage that is preventing blood and nutrients to reach certain parts of the brain, and that would lead to the fact that these cells, brain cells, will die. And also, another thing that can happen is a rupture of vessels, which is called a hemorrhagic stroke, in which there's bleeding. And one of the causes of this can be high blood pressure. Now, looking at this slide, we can see on the left side, there's a normal brain with normal blood supply. Now, looking at the right side, the upper brain, this is an example of an ischemic or an occlusive stroke in which, as you can see, there's a block. And if you look beyond the block, there is no blood supply, causing the shaded area, which is supplied by this vessel, leading to death of this part of the brain. Below is the hemorrhagic stroke that we spoke about, in which we see that there's a bleed in the brain causing damage to the brain cells or the neurons. So that was one type, which was the vascular. Now the other type, and we're sticking to the common types. I do not want to burden you with a lot of details. I want to keep things simple. So the other type here is the frontotemporal dementia. So basically, there is a dementia where there is an involvement of the frontal and temporal lobes. So this is the behavior variant, frontotemporal dementia. So primarily, there's progressive aphasia, which is difficulty talking, and also understanding language. So these are areas of the brain that are basically in this place, which are responsible for speech, either articulating or basically not being able to say anything. So here we have two types of people. Some people will just know what they want to say, but the language does not come out. And there are others who simply are just talking and not making sense. Frontal and temporal lobes are sections, as I showed you, behind the forehead and in the above the ear area. Now, this type of dementia affects behavior, language, motor function, causing progressive loss of nerve cells. So the loss of nerve cells is a common occurrence in all types of dementia. What are the symptoms of frontotemporal dementia? The most notable symptom of behavior variant of frontotemporal dementia is change in behavior. People may suddenly start behaving angrily, aggressively. They can start using inappropriate language, even acting out sexually in a disinhibited manner, declothing in public, or harassing other people. And basically, this can cause a lot of stress to the family and the others. So, this is the prominent symptom here. They may also have trouble forming sentences or speaking coherently. And in this type of dementia, memory loss isn't a symptom that occurs initially. Initially, the behaviors will come, but later on, the memory can be affected. So, the main symptom here in most cases is not the memory loss, but it is the disinhibited behavior. Now, in this slide, I wanted to give you all a basic structure of the brain so you can have an idea of the anatomy. So as we spoke, we see in the red the frontal lobe that helps with thinking, speaking, memory, and movement. And then, as we said, close to the ear area, the temporal lobe, which helps with hearing, learning, and feelings and behavior. Then we have the parietal lobe that also has to do with language and sensation, touch. The lobe in green in the back is the occipital lobe that is basically the center for vision and color perception. Then we have the cerebellum, which is for balance and coordination. Then we have the brainstem that controls breathing, heart rate, temperature. So as we can see that this magnificent organ called the brain basically controls the rest of our body, from movements to sensations to feelings to balance to even heart function and breathing. So now we will come and focus more about Alzheimer's disease or Alzheimer's dementia. So Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. It's not a normal part of aging. It is definitely an illness. It is the most common cause of dementia in older adults, accounting for up to 70% of cases. As of now, unfortunately, there's no cure for Alzheimer's disease, which makes it irreversible. The symptoms of Alzheimer's usually occur after age 65. And this is when, as mentioned, we start seeing the symptoms. But the changes in the brain may begin years, or in some cases even decades before. But they begin slowly and progress. Now, this is a difference if we go back to the vascular dementia. As we said, a stroke can happen suddenly. High blood pressure can cause a bleed at any time. But with this type of dementia, it's a ongoing process. It's a slower process. Having said that, Alzheimer can also hit during the 40s and 50s, and it's called early onset Alzheimer. or even younger onset Alzheimer's that accounts for a very small percentage of about 5% of the people who suffer from the disease. Women are affected more than men. So, in a very simple way, if we want to understand what goes on, what are the changes in the brain that are causing this illness? So, very simply, there's proteins and fibers. What these do is that they start building up in the brain. And as they build up, they start clogging the nerve cell pathways, blocking nerve signals. In the next slide, I will show you a sketch that will make it simpler to understand. But imagine a buildup in a pathway leading to the fact that this pathway is becoming slowly obstructed, blocking signals. Now, toxic, toxic changes take place in the brain, including abnormal buildup of proteins that form what is called, in medical terms, and this is just if you hear this anywhere you read about Alzheimer. So they cause something called amyloid plaques and tau tangles. Previously healthy nerve cells, which are called neurons, will stop functioning and lose connections and communications with other neurons, and eventually they will die. The damage initially appears to take place in the hippocampus and the entorhinal cortex, which are simply parts of the brain that are essential for forming memories. And as we expect, we will start noticing troubles with memory. And as time progresses and more neurons die, additional parts of the brain are affected and begin to shrink. So basically, we're starting from the memory area, but imagine that this illness is progressive, and with time and towards the end, it involves the whole brain. And basically, as brain cells die, the brain starts to shrink. By the final stages of Alzheimer's, damage is so widespread, and the brain tissue has shrunken significantly. So this is the slide that I promised to show you. So if you look at the healthy brain, you can see this is a nerve cell, or what we call a neuron. As you can see, basically, look at the connections. Basically, they're very, very clear, no blockages, and you can imagine that the signals can be transmitted very simply from this cell to the cell next to it that will resemble it. And this is how the signals are transferred. Now, if you look at the Alzheimer's disease cell, as you can see, that the formation of the protein has disrupted the pathway. And obviously, it will, with time, make the signals weaker and eventually will make the neuron or the nerve cell die. Now, this is, again, another sketch showing on the left side, there is a normal brain cell. You can see the size, and on the right side, you see an Alzheimer's brain that has shrunken, and we can see an obvious difference. And this can be seen in imaging, such as CT scans, MRIs. And if you do an autopsy, you will definitely see the size of the brain in the skull is smaller in these patients. So when we talk about signs and symptoms of this illness, we would like to basically, to make it simple, divide them into early symptoms and middle and then late stage. So early stage symptoms, in the early stages, the main symptoms of Alzheimer's disease is memory lapses. As we said, the problem starts in the hippocampus, is where the memories form. So, for example, someone with early Alzheimer's disease may forget about recent conversations or events, misplace items such as keys, wallet, books, other items. They may forget names of places and objects, have trouble thinking of the right word to say. They'll be lost for words. They may ask questions repeatedly, show poor judgment, or find it harder to make decisions. They may become less flexible and more hesitant to try new things. There are often signs of mood changes, such as increasing anxiety or agitation or periods of confusion. Now, keep in mind, early symptoms meaning that not all these symptoms will appear suddenly. And also, they may not appear the way they're written. Something may precede the other. But these are things to look for. And when you talk about mood changes and increasing anxiety, at this stage, most of the patients, they continue to have insight of what's happening. They understand what's going on. They understand the diagnosis, and most likely that will make them depressed and sad because they know about the illness. They may read about the illness and the prognosis. They're still with it. And also may feel anxious for themselves, for their loved ones, for their children. So these are the changes that may cause depression, anxiety, and agitation. Now, the middle stage symptoms in moderate Alzheimer's disease, a patient will be generally experiencing many of the symptoms that occurred in the previous stage, which is the mild stages, but with increasing degree of severity. For instance, memory loss may now span to a person forgetting his or her own personal history. They may forget their locations, such as their house, the grocery store nearby, the laundry, their relative's house, and that can cause a lot of confusion and a feeling of loss, which again, more can get us into a circle of anxiety, distress, feeling sad. And these can be further compounded by being unable to recall personal details. As I said, telephone numbers. And this can also cause increasing agitation. And the patients may start to wander because they're lost. They're trying to find their way back. There is also increasing confusion and disorientation, including not knowing what day it is or what time of the day. The patient may need extra care in dressing, in clothing, appropriate to the time of the day and season. So basically, one of the things that are used to assess these patients, to ask them where they are. So that will give us a bit of a knowledge about, are they aware of where they are, or are they disorientated to place? We can ask them what time it is, what time of the day it is. Is it evening, morning, afternoon? And also, we can ask them about people. Who is this person? So place, time and person, there can be a disorientation. And again, with time, when we talk about tasks such as simple tasks of caring for self might start becoming difficult, such as choosing clothes, appropriate clothes for appropriate occasions. They might be wearing a thick coat in summer or very light clothes in the winter, might have difficulty matching clothes, and so on and so forth. Also, unfortunately, as time progresses and the disease continues to progress, we can see decline in personal hygiene, refusal to shower, refusal to change clothes, mood changes due to decreased recognition, communication skills, and suspiciousness because they may not recognize their relatives. It usually starts with distant people that they don't see on daily basis. But as time passes, even people living with them may appear as strangers, and this can be very frightening, as you may imagine. There's also sleep cycle reversal, restlessness, agitation, and confusion at night, problems recognizing some family members and friends. They can get into paranoia, being scared, and they may start having visual or auditory hallucinations and basically delusions. They also may have impulsive and inappropriate disinhibited behaviors, such as undressing at inappropriate times, places, or in public, or using vulgar language, inappropriate outbursts of anger. Restlessness, agitation, anxiety, tearfulness, wandering, especially in the late afternoon or evening, because as I said, there's kind of a reversal in cycle. They sleep in the day, they're up at night, all the system is basically collapsing. They also may use repetitive statements or movements and occasional muscle twitches. Now, in the late stages, on top of all the decline that we spoke about in early and middle stages, all that will be there and progressively getting worse. But on top of that, we will notice physical decline. There'll be increased susceptibility to infections, including skin infections, difficulty walking and moving, eventually resulting in a person becoming chair-bound or bed-bound, or as we say, bedridden. Loss of ability to communicate through words. Basically, the language areas have shut down. Groaning, grunting, and moaning. Difficulty swallowing, eating, leading to weight loss, total incontinence of bowel and bladder requiring full-time assistance with toileting and hygiene, increased sleeping, eventually inability to sit up or hold up one's head. So basic reflexes from childhood are getting lost. Loss of facial expressions, including the ability to smile, what we call as social graces. And finally, seizures, death from disease itself or medical complications. Now, to make this very simple, imagine, as we said earlier, that the brain is a remarkable organ that we do not know much about with all the research. As it declines with time, we would see that all the functions that are controlled by the brain, from feelings to sensations to physical activities, through thinking, all of them begin to slowly decline until people forget how to breathe. The areas controlling their heart rate, their breathing, they all begin to shut. So then people are going to stop breathing, stop living. So, very sad. And this is the reality of this disease. Let's talk about some diagnosis because, again, as initially mentioned, we were talking about the importance of trying to get to a healthcare professional early for early diagnosis. So, how do we diagnose? So, the most important fact way to diagnose this illness is taking a detailed history from the patient and also from close family members. Detailed history including daily living, medical illnesses, medications, family history, and this will give us a good idea about the illness, when it started, to which stage has it progressed, and what other factors may be contributing. So one of the some of the tests that we can do with the patient, which are pen and paper based, one is called a mini mental state exam, and there's one called MOCA, which is invented in Montreal, and it's a basically a cognitive testing tool. So in these tests, we're looking for memory, attention span, counting skills. Basically, without going into details, we have asking people to identify things, basically recognizing things, remembering certain words, and then repeating them, and so on and so forth. Some drawings. Another way is imaging studies, CT scan, MRI studies to look at the structure of the brain and rule out other causes. Then there is a Precivity Alzheimer's disease test, which is a blood test, which looks at the amount of protein accumulation in the blood. And then we have the PET scan that can detect the protein flakes. This is used in research mainly because it's extremely expensive and the yield of it in terms of cure is not worth it to be done to everybody. If it had the magic cure, then definitely the cost would not be an issue. Now, talking about treatment, again, treating the symptoms of Alzheimer's can provide people with comfort, dignity, independence for a longer period of time and can encourage and assist their caregivers as well. So, as mentioned, there's no cure for Alzheimer's. What we're doing is we're trying to slow the progression of the illness and give people more time and a better quality of life. Galantamine and rivastigmine and donepezil are cholinesterase inhibitors that are prescribed for mild to moderate Alzheimer's symptoms. These drugs may help reduce or control some cognitive and behavioral symptoms and help keep the chemical acetylcholine in the brain for longer because this substance basically is one of the key substances or chemicals that help with the memory and thinking. Now, there are some medications that target the underlying causes of the disease, and they're called disease modifying drugs. Now, there's only one medication that got recent approval from the Food and Drug Administration in the United States. It's called aducanumab. So this is not in use massively. It just got approval, but hopefully with time it will also be available as an additional remedy targeting the protein buildup. So in terms of moderate to severe stage, we have a medication for memantine, which is believed to work by regulating glutamate. Glutamate is a different chemical from acetylcholine. Now, it's an important brain chemical. And what we're trying to do here is we're trying to basically reduce the production of this chemical, because when it's produced in this illness in excessive amounts, it may lead to brain cell death. Again, the main effect is to reduce symptoms, enable people to maintain certain daily functions a little longer than they would without the medication. So no cure. For example, when we use this drug, it may help a person in the later stages of the disease maintain his or her ability to use the bathroom independently for several more months and a benefit for both a person with the disease and their caregivers. Because at this stage, some people are gone psychologically, mentally, the brain is not there. So then we are helping the caregivers. So then again, managing behavioral symptoms. Again, we spoke about behaviors. So the behavior symptoms are also an important part of the disease that may be distressing to the patient at times and to the people around them and at times to the population. Experts agree that medicines to treat these behavior problems should be used only after other non-medication strategies are tried. Common behavioral symptoms include sleeplessness, wandering, agitation, disinhibition, anxiety, aggression, restlessness, and depression. Research has shown that treating behavioral symptoms can make people with Alzheimer's more comfortable while also making things easier for caregivers. Because, as you can imagine, if somebody is agitated, they're wandering, it's not good for them. They may get into accidents, their body may suffer from continuous agitation, and again, they may get hurt others. And again, as we said, making it easier for caregivers who are basically having to deal with these behaviors. So again, first we try behavioral techniques. Then if that doesn't work, then we can resort to using some medications. Now going back to the slide, behavioral means you sit with them, you try to reason with them, you try to stop them. And at times, as the disease progresses, it's like you're dealing with a small child. But we come to a stage where it's not going to work. So with that, we can add some medications that can reduce the anger, the aggression, and the disinhibition and these behaviors. Now, the most important thing that a lot of people don't talk about, which is caregiver burnout, because the whole focus is on the patient. But my question is, what about the family? What about a wife or a daughter or a son or or a husband who is trying to care for this patient? To begin with, they are emotionally going through a turmoil, watching their loved one decline in front of them. And again, they're faced with the dilemma of, do they care for themselves, or do they feel bad and selfish if they cared for themselves and left the patient, who in their minds is the sick one who needs the care? So almost every caregiver experiences burnout at some point. If it does happen and it's not addressed, the caregiver eventually becomes unable to provide good care. Caregiver with burnout has who has become overwhelmed and is physically and emotionally and mentally exhausted from the stress and burden of caring for their loved one. They may feel alone, unsupported, and unappreciated. They often haven't been taking good care of themselves and may be depressed. Eventually, they can lose interest in caring for themselves and the person they look after. So, not addressing caregiver burnout is a lose lose situation. So, how to manage caregiver burnout? Ask others for help. Remember that you don't have to do everything. It's okay to ask family and friends to do some of your caretaking tasks. Get support. Talk about what you're going through and get support from family and friends or support group helps you process your feelings and emotions. Consider seeking professional counseling and help if necessary. Be honest with yourself. Know that you can and can't do. You need to know your limitations. Do the tasks that you can and delegate rest to the others. Say no when you think a task will be too stressful or you don't have time to do it. For example, if you have a lady with already having chronic back problems, if she's going to try to lift the patient, assist him or her, that will add to her suffering and may make things worse. Talk to another caregiver. Sometimes that helps to get support and allows you to give support to others. And you can see that others are probably going through similar circumstances and similar things. That time, you can share experiences of how to cope, and they can do the same. Take regular breaks so you can restore your energy. Use the time to relax, improve your mood. Even small breaks, 10, 15 minutes, can be helpful. Try to attend social activities. You're not a bad person if you take some time to take care of yourself, meet your friends, do some hobbies, enjoy a bit, and avoid isolating yourself because you do need this for you to be at a level of energy and at a level of strength that you can continue to care for your loved one. Pay attention to your feelings and needs. Make sure you take time for yourself, take care of your health. Don't miss doctor's appointments, including preventative care. Take your medications on time. See your doctor if you feel sick. If you aren't healthy, you can take care of someone, you can take some time off. Someone else can help you. Don't forget your needs. Eat healthy diet. Exercise, which is a great way to relieve stress, increase energy. Take time for yourself and also improve sadness, depression, anxiety. Maintain your sleep schedule. Because again, sleep is essential to give your body and mind rest. You can give the night shift to another family member or a nurse or another help. Take family leave. If you work, make use of family leave benefits available to you. Remove the stress of work, can reduce your responsibilities and free up more time for yourself. Talking about the prognosis of the illness, the disease naturally progresses and worsens over time. Most people with Alzheimer's die within 8 to 10 years, but some live as long as 25 years. Some people decline steadily during the disease, while others reach a major plateaus where the symptoms advance quite slowly. People with long-standing history of medical illnesses such as high blood pressure, other chronic illnesses, are more likely to decline rapidly. Additionally, the older a person with the disease becomes more likely that he or she is to decline faster than younger and healthier individuals. An accurate early diagnosis gives affected individual a greater chance of benefiting from existing treatments and interventions. So, what are the take home messages? In a nutshell, Alzheimer's disease is an irreversible, progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. We can slow down the progress of the illness, but we cannot cure it or reverse it. The best course of action is to understand the illness and know what to expect. Knowing the course of the illness helps being best prepared. Caregiver burnout should not be ignored, for it can have negative consequences on the patient and the caregiver. Love, support, and care is the best you can do for your loved one. Help is always there. So please don't feel shy or hesitate to ask for it. There's multiple resources online, offline. You can talk to your doctor. There's many organizations that are there to provide help. So please do not hesitate to ask for help. Thank you very much for your attention, and I hope you benefited from this talk.